Okay, we'll go ahead and get started. Welcome everyone. My name is Sean Wood. I am the Community Liaison for the University of Utah. Welcome to the Spring 2021 Community Forum meeting. We have great agendas for you tonight. We hope you find it valuable. I would just like to first start off by saying that this meeting is being recorded and will be made available for the public after this meeting. And next, I want to start with the University of Utah's land acknowledgement statement before we get started. So we acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral home of the Shoshone, Paiute, Goshu, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many indigenous peoples and their traditional homelands. We respect the sovereign relationship between tribes, states, and federal government, and we affirm the university's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Like I said, we have a full agenda, and we will start by introducing the newest addition to the Board of Trustees, Kim Brunisholz. Kim, would you like to take a minute and introduce yourself to our neighbors?
Thanks, Sean. Hopefully you can hear me. Thank you for the invitation to attend this meeting. And as the U Alumni Board of Governors President over the next 2 years, as well as the Board of Trustees member, I'm really excited to be a part of this meeting and to visit with our community partners. Engaging our communities broadly is a big goal of ours in U Alumni, and so we're really excited to be a partner at the table. Thank you, Sean.
All right, thank you very much, Kim. And then next, we'll jump right into it. So one of the questions that is on top of everyone's mind is what is happening with the presidential search? President Ruth Watkins has announced that she'll be leaving in April. And as many of you may have seen, Dr. Michael Good has been announced as the interim president. So I want to turn the time over to Commissioner Woolstenhulme with the Utah System of Higher Education to give us a rundown of what to expect over the coming days as the search unfolds.
Yeah, thanks, Sean, and welcome everybody. It's a pleasure to be here with you this evening, and thanks for joining in. I wish we were here to tell you that it was just a big joke that President Watkins is not leaving or going anywhere, but unfortunately I can't say that. But we really do appreciate President Watkins and the great service that she's provided both as a provost and as the president at the University of Utah. There's been some amazing things accomplished with President Watkins' leadership and the great staff and leadership team that she's put together. One of the best things that we can all be proud of the University of Utah is the completion rate. When students start to be able to complete their programs in a timely manner is something that I know President Watkins is really focused on, and her team has done a great job of moving forward. So I want to give you just a little bit of an update of where we're going and what we're doing in the search process so that you as community members will have an understanding of how that takes place. Under the statute, under state law, it's the Board of Higher Education that is charged with appointing new presidents for our public colleges and universities, but it's in consultation with the local Board of Trustees. And so keep that in mind as I go through these next few talking points, that it'll be the state board that makes the final decision, but they get a lot of feedback from a lot of different people throughout that process, and one of them being the Board of Trustees there at the University of Utah. The committee that the state board has put together is going to be chaired by Christian Gardner, who is the chair of the trustees at the University of Utah, and Chair Harris Simmons, who is the chair of the state board. And so the two of them will be co-chairing the search committee. The search committee is made up of a large group of individuals. In fact, I think there's 26 individuals on the search committee, and you probably have already seen the list that's gone out into our press release and into the papers. But they're trustee members, they're the state board members, faculty, staff, students, administration, alumni, community members. There's a good cross-section of individuals that are key players in the institution that serve on that search committee. The committee, like I said, was selected and announced at the beginning of February, and At the same time, Michael Good, Dr. Good was named to be the interim president there at the University of Utah. The search committee convenes the public together, and you'll see, we'll put up on the screen here in a minute, some public feedback, some town halls that we'll be holding. One of them starts tomorrow. In fact, we have 2 this week and 1 next week, where we really do want public feedback on what it is that you're looking for in the next president of the University of Utah. Again, we've had great presidents there. We want to continue that tradition. And a big part of that is make sure we get community feedback on what it is that you're looking for in the next president there at the university. Really the role of the search committee is to screen candidates, applications, and then to conduct the interviews, and then try to forward on 3 to 5 finalists to the state board and to the board of trustees. And so think about that as the search committee. We do have a search firm that will be helping in that process. And so they'll do the initial screening, bringing the qualified applicants forward to the search committee. Then the search committee will search through those applicants, interview the applicants. The first round of interviews will be done over Zoom. And then hopefully by the time we get to the second round, we'll be comfortable enough to where we can do those in person. And then the search committee will forward to the state board the top 3 to 5 applicants at that point. So we really do want your input. We want your thoughts, and you can do that through these next few nights in the town halls that we're going to be holding. For a candidate to be moved forward as a finalist, 2/3 of the search committee must vote on moving that candidate forward. So for a candidate to get through as a finalist, again, it takes 2/3 of the vote of the search committee that says, yes, this individual would be a good applicant, a good candidate for the position at the University of Utah. So 2/3 votes. At that time, the names will be made public. There is some discussion right now with the state legislature of maybe not making the names public, but at this point, the bill states that the 3 finalists would be named and would be made public at that point. At that point, finalists then meet with campus groups, including faculty, staff, students, and trustees. And what the state board is looking for at that point is feedback from those groups on those finalists. Who do they think would be the best president moving forward? And then that information will be shared back with the state board. And then the state board will do their final interviews and discussions and deliberations with the board of trustees. And then hopefully at that point, we can determine who the next president of the University of Utah will be. The biggest question that most people have is the timeline, right? And so let's discuss a little bit about the timeline and when we would expect to have the next president named for the University of Utah. A presidential search can take anywhere between 8 to 12 months. We want to move quickly, but we do not want to rush it. Anytime you're selecting a president for the flagship institution of the state and the impact that has, the flagship institution has on the state of Utah, we definitely don't want to rush the process. So we're giving ourselves a little wiggle room and saying anywhere from 8 to 12 months, we would expect to have that president named. And so we start the process now. The search firm is in place. We start to do the town halls. We'll start to collect applications from across the country. We figure with the University of Utah now being an AAU school and the great things that are going on financially and economically in the state of Utah, we feel like that we're going to get some great applicants for the position as president of the University of Utah and what the state and the U has to offer. So we expect there to be a large pool, and we expect there to be a deep pool that we will start working with the search committee to be able to do that. We would hope to hold the final interviews sometime in the latter part of July is what our thoughts and hope would be. And then hopefully name a president right after that, depending on what their situation is in their current employment would really depend on what the starting date for that successful applicant would be. So for input or thoughts, please go to the presidentialsearch.utah.edu, the presidentsearch.utah.edu. Let me say that right. So it's presidentsearch.utah.edu, and you can give your feedback there, and would love to hear from feedback. And plus that'll be shared with you again in the town halls will be starting tomorrow night. So the town halls will be held on February 24th, 25th, and then again on March 2nd. And we can share the dates and time with you in the chat, so you'll have all that information. So that's kind of where we're at now. Again, we definitely want to thank President Watkins and her great leadership team there at the University of Utah. And whoever comes in is going to have big shoes to fill, and we're excited to start down that road.
All right, Commissioner, thank you very much for your time. We know that you're very, very busy, so you're welcome to stay, but we understand your time constraints. So thank you again.
Thanks, Sean, and thanks for all you guys do.
Yes. All right, now we'll move on to spring semester updates here at the University of Utah campus. And we have with us this evening, Dr. Dan Reed and Dr. Lori McDonald. Both have the most information to share as it relates to testing on campus when it comes to COVID and just how students are being served. So, Dr. McDonald, as the Vice President for Student Affairs, can you talk about our current testing plan and what types of support services are being offered to students?
Certainly. Thank you so much. I'm happy to be here and appreciate everyone's participation. As Sean said, I'm Lori McDonald, Vice President for Student Affairs, which includes so many of those different types of support resources that we hope are helpful for students to be successful in the classroom in terms of getting through some of life's challenges that come about. So we are very fortunate to not only have an academic medical center as part of the University of Utah, but to have such a robust research mission and functions. And we have learned so much about this pandemic, the virus, how to manage running a university with some public health measures. And this spring, starting in early January, we have been able to offer our campus community asymptomatic testing for the coronavirus. And we still offer symptomatic testing for those that are experiencing some type of symptoms. We have a number of those throughout the Valley, and do have a hotline that we have our students, faculty, and staff call for some support on how to find what's most appropriate if they are experiencing any type of symptoms. But this spring, now the asymptomatic testing is for those who feel perfectly well. And not necessarily have they been identified as having been in close contact with someone, but we know that that several people do carry this virus and not have symptoms. So testing can be a way to determine if they do have the virus and can take precautions like quarantining or isolation. And so we do have this available to our campus community at no cost, and encourage anybody who's utilizing the campus community in person, if they're coming to classes or utilizing any services, we really encourage them to do this on a weekly basis. So our students, our researchers, our staff, our instructors are all encouraged to do this. And we are offering it in 2 different locations on campus, and have been able to get responses for the tests within 6 to 24 hours. It's a PCR saliva test. There are those who would know much more about the science about it than I do, but it is, we're very, very pleased with this. Since middle of January 11th, when this started, we have conducted over 15,000 tests. We average about 3,600 a week. And we are so appreciative of our campus community. I heard from a staff member the other day that just said, thank you for this opportunity. It makes me feel like I'm doing something for our community, including all of the other public health measures of taking precautions. And I know our students have been really great about doing it. We do require our students who are living in our housing and residential education facilities to do this, and are encouraging everyone else to do it. And it has been a very helpful community tool for helping to monitor this. We do encourage everyone who is tested to not forget the public health measures like distancing and wearing face coverings and increasing hygiene. Testing is a snapshot in time, but it is certainly a helpful tool for our community to stop the spread. So that has been really, really helpful. During our return to remote situation in the next 2 weeks, we will continue the testing. And we do have a number of student support services. Sean, you asked me to address that too. It has been very inspiring to see how departments and students, our student leaders, have been creative about being able to provide our support resources around certainly mental and emotional health, physical health, financial health, academic health and wellness, social and financial, all of these things. We have a lot of offerings virtually, from advising appointments and different types of meetings. Our students have gotten very creative about some social meetings that can be done virtually. We have home workouts. Our campus recreation center provides home workouts, in addition to some limited in-person services on campus, particularly for those students who are living on campus. Our housing and residential education spaces, we've de-densified. We don't have as many students as we could have in the halls. And our housing and residential education staff do provide support services for those who are identified as needing to quarantine or isolate. We do have some rooms that are single rooms that have their own bathroom, and so a student could do that in their own room. But for those who do not have that situation, we have a number of rooms set aside for that purpose. And we do meal delivery and check-ins on a daily basis. And we've had other student groups volunteering to connect with students and deliver care packages. And it actually has been inspiring to see how supportive our community is. But it's ongoing monitoring, and we will likely continue some of these virtual services even when we can return to more regular operations, because it has increased some access in many ways. So we've learned a lot through this entire situation. Thank you.
Thank you, Lori. Dr. Reed, as the Senior Vice President for Academic Affairs, what is the university thinking in terms of modalities for fall semester?
It's a good question, because clearly many things are in flux as we look at shifting caseloads for COVID and, of course, accelerating vaccine availability. So maybe I start by explaining where we are and then talk about a little bit about where we're thinking for the fall. As Lori just mentioned, we looked a lot at which classes can be effectively offered online. During COVID, our priorities for those to hold in person were to ensure that we preserve some first-year experience for students so they got a sense of what it was like to be on the university campus. And then there were some things that one only learns by doing, so-called experiential education. And that's everything from science and engineering labs to art studios to music and theater performances or architectural design. And then, of course, all the things that take place on health affairs side of campus, nursing, medicine, pharmacy, all of the things that are part of you learn by doing. And then for the other things that are predominantly lecture, those were more delivered online, either in real time as we are now with streaming video, or asynchronously where students could take those at their leisure. So about 20% of our classes this semester are fully in person. Somewhere between 40 and 50% of the classes involve some in-person component, and then the remainder are fully remote. As we look at the fall, and I spoke to my Pac-12 counterparts on Monday, and we talk every 2 weeks and share ideas and what we're seeing and best practices. We do expect there to be more of an in-person experience on campus in the fall. You know, all of this depends on the rate of vaccine deployment. And as we all know, vaccine availability is still somewhat limited. We're all optimistic as we see the stories about increasing availability. And so vaccinating faculty and students will take place as more of the vaccine is available. So we expect that the fall won't be fully back to normal, because even under the best case scenarios, most people would have only recently been vaccinated when this semester started, or maybe even partway through this semester. So we would still have physical distancing and likely face coverings, but we would have a much larger likely percentage of the students on campus. Exactly what percentage? The longer we wait to make that decision, the better informed we will be in terms of what information we actually have to make that decision. What we do expect, even in the most conservative case, that we'll have a larger fraction of students and faculty back on campus. And as Lori touched on, much more of the traditional in-person student experience, because there are many things you learn in the classroom, but one of the great things about a research university like the U are all the things you learn outside the classroom, not only the social engagement, but community service and undergraduate research and scholarship experiences. That's part, as well as the social aspect, that's part of what really a 360 education is about. And we're all anxious to get back to as much of that as soon as we can, but in a safe and effective way. And we have erred on the side of conservatism in the U. And I think it's fair to say the partnership between the academic side and the health side and the collaborative planning with faculty, staff, and students has been to think through each situation about what the risk and the reward was, what we could do. And that partnership is what will see us forward as we plan for the fall.
All right, thank you. I think another question that's out there is, and you kind of touched on this, is what is the vaccination rollout once the vaccine becomes more available? I know you're not a doctor, but if you could try, some people think that students will be getting the vaccine sooner. Some people think that faculty will. So could you address what the university's plan is?
Sure, we'll certainly take a shot at that. We are bound by the state public health policy and priorities. And when I say we, I mean all of the University of Utah, and that includes U Health, not just the academic side. And so the prioritization is the one that you've seen publicly with the coming reduction in age to 65. And so if you sort of look at that progression and the path, it will be a while before we see typical middle-aged people, and certainly healthy young adults will probably be at the end of the pipeline. It's important to realize that university faculty are not included in the teacher vaccination pipeline, with a few rare exceptions. So faculty are not part of that teacher cohort that's related to K-12. And so only recently has U Health begun to receive weekly shipments of vaccine that it will begin to disperse to U Health patients, but again, following the state guidelines about priorities with respect to age, comorbidities, high risk individuals. And all those guidelines are shaped in collaboration with the state. And the U has continued to work with county and state public health on those priorities and policies. And Lori, I don't know if there's anything else you want to add to that.
No, I think we stand at the ready. Our Student Health Center has completed all of the documentation to be a site for their patients as soon as it may become available. But we are also recruiting volunteers. The state Department of Health has requested volunteers in many areas to help with this, and we know we've got a number of students and employees who are willing to help with everything from directing traffic to the actual distribution. So we stand at the ready.
One other thing I forgot to mention that might be worth knowing is, we have regularly surveyed our students about the quality of the experience during the pandemic. And I wanted to note that compared to this time last year, which if you remember was really before the pandemic took hold, Enrollment at the U is up. We have more students enrolled in classes on campus than we did a year ago. And that's really a testimony to a lot of hard work by a lot of people to engage and support students over the past year.
Thank you both. I really appreciate you joining and talking with us tonight. I want to, before we move on in the agenda, I want to address Steve Alder's question in the chat. Steve, we had 77 people register this evening for this event, and I'm receiving emails that other people are having difficulties logging in. I'm not quite sure where the error lies. It could be with the way I set this meeting up, but I apologize for that. We're not trying to limit the number of people who attended this evening. And this, again, this meeting is being recorded, and we plan to share this video afterwards for the community. So apologies for that.
Yeah, Sean, I would just add, I know we put some restrictions on this. The restrictions we put on it is really to avoid Zoom bombings, and we've had some unpleasant episodes, and so really we're trying to follow best practices. There's again, we look forward to seeing everybody in person, hopefully in the next year, because I agree with you, Steve. The benefit is for the community to connect, and we'll get back there, but just want to make sure people understand why we've got some of these restrictions on. Thanks, Sean.
Thank you. Okay, now we will move on to Jonathon Bates, the Real Estate Administration Executive Director, to give us an update on Research Park. That is definitely still a topic that the community is thirsty for knowledge about. So Jonathon, we'll turn the time over to you.
Thanks, Sean. I appreciate that introduction. And first and foremost, thank you to our community members for sharing your concerns and ideas. The dialogue and the feedback from the community through this process has been extremely beneficial, and we continue to welcome that feedback as we continue down this path. Please know that we have heard you, and with your input, we're continuing to evaluate elements of the vision with our senior leadership and our Board of Trustees. As I mentioned before, we continue to encourage individuals to visit our website and to solicit feedback, reach out, let us know what you're thinking. And we will provide additional details and opportunities to provide feedback will be made available as soon as the process continues, particularly as the U searches for the next president of the university. Again, we will keep you apprised, and we appreciate your feedback and your interest in this process.
Jonathon, would you mind pasting the link in the chat for people to access easily?
Absolutely, I'll put that in there right now.
All right. We are not joined right now with the next presenter, Brian Eccles, to update you on the racist and bias incidents response team here on campus. So we will move to Robin Burr to give the Chief Facilities Officer to give us an update on campus construction.
Thank you very much, Sean. Let me just load my presentation here. Appreciate the opportunity to be here. And as I do typically at these events, I'm going to just provide you some updates on our major projects in design and construction. So first up, we have 3 major projects that are in early stages of planning. Medical Education and Discovery Building, which is the replacement for our medical school. The Impact and Prosperity Epicenter Building, which is a building with the David Eccles School of Business, and you'll see more about it. And then the West Village Replacement Housing, which we talked about last time. So I'll go into each of these with one slide with a little bit of detail. First up is Medical Education and Discovery. This is very similar information that was shared at the last community meeting. We plan to build a 250,000 square foot medical school replacement. It's replacing the old School of Medicine, which is actually 650,000 square feet. So it'll be a much smaller building. And it will also include some innovation, discovery, and global health programs. At this point, we hope to start construction early in 2022 and be done for the fall season in 2024. Second building, Impact and Prosperity Epicenter. This is one that we haven't brought to the community before. It is very new. We are working our way through approvals in the legislature for permission to move forward with this project. We're doing some very early programming. So what you see on the screen is a diagram. We don't have any building drawings yet. But this building will be like Lassonde in that it will be a combination of housing and education and research functions. This one will have 575 beds and will house the Center for Global Health and Prosperity and the Sorensen Impact Center. You can see on the campus map, we plan to locate it just east of Lassonde Studios. It places it nicely in the center of our campus with other housing, undergraduate housing, so that they can share resources, the Student Life Center, the cafeteria, and the newest housing, Collard Village. Our hope is to receive legislative approval, do our design documents this year, and break ground end of this year and be open for the fall semester in 2023. And then last, this is an identical slide to the one I showed at the last community meeting. We're getting ready to move into programming on this project. So it has been pretty much holding while we work our way through the approval process. You'll remember from last time that we are taking down 2 courts of buildings in the West Village, the 400 and 500 courts. They are very much at end of life, very difficult to maintain the infrastructure. And we're going to replace it with higher density housing in that area, which will allow us to take down the other failing units over time and be considerate about how and when we build more housing. There was a question about how we will carefully address our neighbors to the south in Yale-Crest, and I think that's a great question and a very important one. As mentioned before, we plan to set the building back from the street quite a ways, to use a lot of greenery to screen from the street and to use that buffer area to add parking. We also have received feedback from the community, very helpful feedback about the style of architecture in Yale-Crest neighborhood and how important that is and how valuable it would be to look at that as we design this housing. And we do intend to include some of the material we received in our RFP as an exhibit so that as we bring on an architect, they understand the challenge we're asking them to face, to look at how to be a good neighbor in this community. This also, we hope to start construction this fall and be open for the fall semester in 2023.
Robin, before you get too much further.
Yes.
So back on the previous project, Josh Stewart asks, how many people do you expect to continue to telework at the medical center, and how many will continue to telework at Research Park? It's been nice to see the reduction in traffic in the communities. We agree. And I know that out of the president's office, there is an evaluation going on to look at just that, to look at what we have learned from the pandemic and to use it as an opportunity. What we've learned is that many people appreciate being able to work from home, appreciate not having to commute, being able to tend to small children, in a more consistent fashion. And for us, it means reduced congestion. It means we don't have to continually face the need to build more and more parking. And it stresses our public transit systems a little bit less. So I think the main point is that we agree with you that it's been good for our campus to have a little bit lighter traffic there. And it's being evaluated. I can tell you from my department, I have people who manage projects who seem to be doing fine working from home and coming in for job site visits. And then I have the people who maintain and clean the buildings who still have to show up. So each department will be asked to evaluate, what works best for them. But the goal is reduce traffic. Okay, thank you. And then we are still getting some comments and questions about Research Park. So after Robin's presentation, Jonathan, if you don't mind, we're going to come back to you. If maybe you could expound a little bit some of the information you're sharing in the chat. And then Robin, Josh also has a concern about the compatibility of the architecture in the married housing. Do you have anything to respond?
Yes, what I would say to Josh is this is what you see here is not the architecture. We were required by the state to put together a feasibility study that in order to establish scope, schedule, and budget, we are now going out with an RFP to bring on a design and construction team who will start the programming and look at what this village is to look like. Basically, we know the number of units, we know the types and sizes of units that we need to meet our demand, and we know where it's going, but everything is up for grabs. And Josh, with your permission, we would actually like to share what you prepared and sent to us as an exhibit in the RFP, because I think it speaks very well to what's important in the Yellcrest neighborhood. So don't think of this as the architecture. It's really a massing block that needs to be relooked at.
Okay, thank you.
Yeah. Okay, do you want to stop and let Jonathan answer questions now, or you want?
No, we'll finish with your presentation and we'll come back to Jonathan.
Okay, so next are the major projects in construction, and we have quite a few going on here. And I'm going to start at the upper end of the screen and kind of go in a circle. But projects first, we are getting ready to start pretty major work on North Medical Drive, starting from the Mario Capecchi and North Campus Drive intersection, going up the hill, and to build a new parking garage there that will serve students, faculty, and staff at the hospitals. It's a 1,400 car garage. You will begin to see, if you go up North Medical Drive, that's where you'll begin to see the work happening, the roads being widened. We're going to build the outer lanes on the north and south side so that we can begin to dig the tunnel that will go down underground and allow people to enter the parking garage without driving all the way up the road. So that is getting underway now, and you'll see a bit more detail as we move on. Then next is the Catherine Kirk Comprehensive Cancer Care and Women's Cancer Center at Huntsman Cancer Institute. We also call it Huntsman Phase 5. It's their 5th building up there. Talk a bit about that. And then another building, Healthcare Educators, Leaders, and Innovators Complex, or HELIX. This is a faculty and physicians office building that I'll show you a bit more about. That is, will house many people who will no longer have a home when we take down the old School of Medicine. Next up, Ken Garff Performance Zone at Rice Eccles Stadium. You can see the progress coming along there. We are moving right along, drying in, beginning to frame, and we'll be ready for the fall semester. And then last is our new public safety building that will be going up in the Guardsman Way lot. And I'll show you some more images of all of these. So here's the garage and North Medical Drive improvements. You can see the extent of the road work in the drawing on the left. We'll be adding a couple of roundabouts to smooth traffic, calm traffic. We'll be creating a tunnel that takes you underground and into the new garage. Lots of work there. And you can see some images of the parking garage. This is the expansion of the Huntsman Hospital. It's a 50-bed bone marrow transplant unit, faculty offices, and some support services for the building. This is completing in the fall of 2022. And if you go up the road, you'll see that steel is going up right now. The steel frame is being built. This is the Helix building. This project just started about a week ago. If you are up on Mario Capecchi or on Wasatch Drive, you can see that a construction fence has been put up in the area just to the south of the Primary Children's Outpatient Center. It is being built in that wedge between our parking area and tracks. So all construction traffic will be entering the site from Wasatch Drive and using the existing driveway and part of the parking lot there. You can see some images of the building. Up above, you're looking north on Mario Capecchi. You can see that we're going to build a bridge across the street, which will actually allow anyone to get from tracks and up and into the hospital without having to go out in the weather or traffic. The image below is looking east from up in the air near Wasatch Drive. You see the rounded end of that existing parking deck and the building beyond it. Our Rice-Eccles Stadium project, I think everybody's familiar. It's replacing the little Clark building that was demolished last November or December. It's adding all kinds of wonderful amenities in terms of seating and clubs and suites. And we're upgrading game day support spaces, meaning football locker rooms for our team and for visiting teams. It's well underway in construction and will be open this fall, and we are crossing our fingers that there will be a football season in the fall as a grand celebration of this building.
Robin, there is a question about the stadium expansion. Has a vendor been chosen to run the restaurant in the new stadium building? Do you have
I believe the vendor has been selected. I'm not sure if it's been announced yet.
Okay. And another question is, will there be any public parking in the new parking structure for the hospital?
The public parking lot is across the street right now, physically connected to the hospital, and University Hospital's preference is to keep the parking that is closest to the hospital for our patients and visitors, and to have staff a little bit further away. We will be making some repairs to the patient and visitor garage, and so we will be shifting traffic around there. There will be a couple hundred spaces on top that are dedicated for the Huntsman Cancer Hospital, and then 1,200 for the hospital. And we haven't entirely determined what the makeup is going to be of those, of those spaces. So that's still being discussed, but we understand we need to make sure we meet the needs of patients and visitors.
Also garage related question that came in. With a 1,400 car garage, will some of the surface parking go away so there isn't a huge net increase?
Where we are building was not a surface parking lot. So this is considered net new for now. But what it's going to do is allow us to do a few things. Initially, it will mean that we'll move patients to the new garage for about a year while we make major repairs to the hospital terrace garage, which is kind of the long, narrow one that sits on the west side of our hospital, without losing spaces. We needed to make some major repairs to that garage, and we could not figure out how to displace 950 patients and visitors. So this allows us to do that. The other thing we think it will allow us to do over time is that we have a number of garages on campus that are aging out, that are coming to the end of their life. And if this works out well, we will be able to take down other garages like the West Terrace garage, which is now all faculty and staff, and not replace it. And that's kind of how we see this. We see this as surge capacity that will allow us to deal with our older structures over time.
Where is that west garage, just for anybody who may not know?
I can't show it to you on this drawing, but it sits, if you go up Mario Capecchi past the old state health department building, you'll see a service road that turns up the hill to the east, and the parking garage is on the left, right, just west of the new addition to the hospital, the ACC.
Okay, thank you.
Yeah.
And I don't know if this is the question, but this may be. So will there be any other additional surface parking be going away, and the plans for existing parking lots on campus?
So yes, surface parking will be going away as we build the David Eccles School of Business building that is partly being built on a parking lot. There will be some parking going away as we build the public safety building in the Guardsman Way lot. And for that parking, we will try to replace it elsewhere if we can, as we can. But this gets to the point made earlier about the value of not having every staff or faculty person on campus every day if we don't have to. There was a question that came earlier about what are we doing to deal with this congestion. And one thing we're doing is looking at whether everyone needs to come to campus every day and what the alternatives are. But also our campus planning department has just completed work on a mobility hub study with Salt Lake City, the VA, UTA, and UDOT to look at how to make hubs for transportation to come to campus so that it's more convenient for people to use public transportation and to not bring a car up to the campus.
This was a question I believe I saw it earlier in the chat. I can't find it right now. And this may be related to Research Park specifically. But do you have a general idea of where those mobility hubs could be placed on campus or will be placed?
Yes, we do. And there are 3 of them planned. One of them, the city would like to build at 2nd South, I think, as it meets our campus on University Street, to make that a place where buses can come to the east from town and disembark there. We're also looking at one near the South Campus track station, so that track station would be a transfer point to shuttles and buses. And then we are looking at one to serve the medical center. And we go back to the helix drawing. I can show you where it's going to be. If you look at that gold colored circle where helix is going, if you know the area, you'll know that there is a footpath and a bicycle path that go from Wasatch Drive up the hill to Mario Capecchi and take you right to the tracks platform. And that's the south edge of that circle. The mobility hub to serve the medical center would be just to the south of that in the upper tier of the parking lot, which would allow people to disembark from buses there, go right into the new bridge we're building here and cross the road and go into the hospital.
Okay. And somebody Shelby has responded with, I understand the growth leads to development, yet it seems like there will only be buildings and not much open space nor trees, etc. The hill seems like it will be maxed out and be all buildings. Well,
that is not our goal, and that is something that campus planning is looking at very carefully, is what should be preserved as open space. So yes, I acknowledge that that is a challenge, and that is something we're trying to address.
Okay, thank you. Now, jumping back forward to the stadium, do you know what the net increase will be of the seats?
I don't have an exact number, but I think it's about 4,000 or 5,000 additional seats.
Okay, thank you. Okay, I think that we've addressed most of the questions so far. There's still some related to Research Park, but please continue.
Okay. One other slide here related to the stadium. You may notice that our 2002 Olympic cauldron went away from campus to be refurbished and is back. And you can see it near the stadium. It's on its pedestal. The rest of the work around it hasn't occurred. It's going to occur over the next several months, but there will be a plaza and some historical information about the 2002 Olympics. And it will be outside of the fence this time, so it will be accessible to everyone all the time. And then last up, our new public safety building. This is a small building, 25,000 square feet, 1-story building that replaces our current public safety building on South Campus Drive, which is in old World War II buildings, really at the end of life. This is a modest little building, but meant to be a community center. It's going to have a very large conference room and all services related to public safety here. We are getting ready to break ground any minute now and plan to have it done by the end of this year and open the 1st of January. That is the end of my presentation.
Okay, thank you.
Thank you.
Okay, Jonathan, if you wouldn't mind, let's jump back over to Research Park. Is there more information that you can share, timeline, public input periods, where it stands on approvals, that type of information? I think that's kind of what we're gathering from the chat.
Yeah, so I want to make it clear, the university is not proceeding with any additional work on the strategic vision. We have been having some internal conversations and working to schedule additional conversations with senior leadership in our board to review the feedback that we've gotten from the community and to develop a strategy and a timeline for how we address that and how we move forward with additional community engagement. I do want to address this pivot to a 10-year plan. We have had a conversation and we have looked at ways to focus the energy around what development potential is there over the next 10 years and what work can we do from an infrastructure standpoint and a transit and transportation improvement standpoint to improve that or support that. We have been engaging in conversations with our partners at Salt Lake City Transportation, as well as at UTA and UDOT, to share information about what we feel are critical infrastructure improvements for Research Park to increase the mode split and make transit more accessible for the current population, as well as any additional growth. But we truly are in somewhat of a holding pattern as we work to have those conversations with senior leadership and our board on how we want to move this forward.
Okay, thank you for that. If you wouldn't mind, let's just give it a minute to see if anybody has any questions that you can address, if you don't mind. And those can be posted here in the chat.
So one thing I'll bring up, Sean, is the open space component. I had a good conversation with Councilman Dugan the other day about what the open space would look like in Research Park in the strategic vision. And we're actually looking at increasing the programmable functional open space in research by about 18% from what you see today. Now, I have to acknowledge some of that is taking away grass or sod and building setbacks and implementing more strategic open space initiatives like the green spine and the social spine. But we are working with our planning partners to really maintain and increase the accessible open space in Research Park.
Jonathan, two questions. Well, and Robin as well. So in response to, it's not our goal to have more buildings and less green space. Open space continues to disappear in the name of development. And I'm afraid Research Park will be more of the same. And then tied in with that, the mobility hub location, has that been identified for Research Park? So I'm not sure who wants to take the first and the second.
So I'll go ahead and jump in, Robin, sorry. Mobility hub in Research Park. So the strategic vision identified 2 smaller mobility hubs and 1 large main mobility hub, all 3 located on what we call the campus circuit. The main large mobility hub was identified for somewhere in the area of the intersection of Wakara and Arapeen, which is the intersection that the existing Marriott Hotel is on. And then the smaller mobility hubs were located near Chipeta and Wakara, up near the historical Fort Cemetery. And then there was one located on Chipeta as it gets down closer to that Arapeen intersection.
And then I think you can address the open space and green in Research Park question too, green space.
So what is programmable open space?
Great question. So programmable open space is functional open space where you can have actual events. So that could include plazas. It could include green space that's activated with outdoor classrooms or convening spaces, food truck pop-ups, water-wise sustainable on-site treatment of stormwater, all those types of functional, actionable open space, trails, trail networks, those types of features are what we consider programmable open space. Parking lots are not considered programmable open space.
Okay, thank you. There is a question that says, can there be community representatives in on the meetings that you have with the board as the community feedback is reviewed?
That's a question we'll have to explore with senior leadership, and we can get back with the community on.
Okay. I haven't even read this question yet, so bear with me. What alternative power sources are being used in all these new buildings? Solar, wind, innovative insulation, need clarification. How are we reducing our carbon footprint? Will we be overbuilt with fewer people coming back to campus to work?
And I can take that question. We are doing a pretty good job of investing in alternative power. About 50% of our campus is fed through geothermal power at this point. And we signed a contract last fall for an additional 20% of power that will be supplied through solar. So we will, as the solar project completes, our campus will be fed 70% from alternative energy sources. We're actually one of the leaders in the country in higher education in this area. We are also working very hard to stop burning gas. So all of our new buildings in the last 5 years have been all electric, except for hospitals that have to have gas generators in order to have backup power. But we are requiring our buildings to be all electric and not gas fed as we build new.
Robin, I believe I saw some information that came out just recently, within maybe the last month, where we're making strides on making sure all of our systems are smarter and working more efficient. Could you speak to that a little bit? Oh, sorry, you're on mute.
Sorry, I was reading a comment. Can you repeat the question?
I remember seeing something recently that your team had some information to share with campus about how our buildings are and the electrical systems are working smarter, not harder, and they're being constantly updated. So could you share some information about that is also feeding into our carbon footprint, reducing our carbon footprint?
Yes, we have a team in facilities management that is dedicated to sustainability, and they survey our buildings both physically and through measurement to determine which buildings are efficient, which aren't. And the university over the past several years has made a pretty big investment in upgrading systems so that they're more efficient, buying more efficient low NOx boilers, upgrading controls, electrical systems, things like that. And we actually have created a bit of a revolving loan fund that the university has given us money to start, and now we take the energy savings and we reinvest that every year in our next year's projects. So we as a university are doing a pretty great job of making sure that our campus is efficient, that we're not contributing to the pollution in the valley, and that we are really a leader in sustainability.
Okay, thank you. So I apologize that I didn't get to the information about the trails, the question that arose. Jonathan, Andrew did post a response, and Jonathan, thank you for bringing it back to the top of mind. So I didn't mean to ignore that question. So
Here's what I can tell you about the trails. Andrew King, who is our campus planning director, is in the audience and texted me some information. We are partnering with Salt Lake City to try to undo the new trails that are being cut into the hillside, to take them out so that we focus traffic on the main trails. We have made some investments as we do projects. We, make upgrades around our projects that are built back near the trail, but Salt Lake City actually takes the lead on maintaining all of the Bonneville Shoreline Trail, even the trail that runs through our site. And Andrew King posted a link to the Salt Lake City site here in the chat that provides a lot more information, as well as the person with the city who's responsible for it. His name is Louis Kogan, Kogan, and his full-time job is to take care of the Bonneville Shoreline Trail.
okay, thank you. We do have one more presentation. Unfortunately, the Brian Nichols, the presenter, isn't able to join us. So Chris Nelson is going to fill in the best that he can just to share that information. So Chris, I'll turn the time over.
Yeah, thanks, Sean, and thank you everybody for participating tonight. We've been posting some of this information. I think we'll add Carrie Case, who's the university's relatively new sustainability officer, chief sustainability officer, to a future meeting as well, so the community get to know her. And I think there was just a miscommunication on our part and Brian Nichols' part, but I just wanted to briefly share a new initiative team that's at the University of Utah. And it's called our Racist and Bias Incident Response Team. And this is a partnership between our Office of Equity, Diversity, and Inclusion, as well as University Safety. And basically, just in a nutshell, and I think it's important for especially the neighborhoods to understand this, is it's an ongoing and kind of increased commitment to the university's kind of response to these racist and bias incidents. And I would just direct you to the site. Pretty much our new protocol is, as these incidents are reported, our safety office investigates this, and then we post information. And this might be as a small event as a posting of a white supremacy flyer on campus to a harassing phone call. And the feedback we've received from the campus and particularly members of our underrepresented community is how important it is for the university to hit these issues head on. And so Brian Nichols, if he was here, he is actually staffing this group. For instance, we had a Zoom bombing on December 2nd. We actually had one last Friday. He's posting a new one here as well. And again, the attempt is just to surface these, make sure people are aware of them, and just add a new layer of transparency. And again, if as a community member you see something on campus, we would encourage you to submit that as well. So I just want to make sure people have that information. Thanks, Sean.
Yeah, thanks, Chris. Okay, so we are, that is our agenda. If anybody would like to submit another question, we will stay on for those. But thank you for joining us tonight. I want to personally thank every one of you for joining. And I understand that there were hassles with the Zoom platform today, and I will work diligently to get these resolved for the next meeting that we host, so that more people are able to join and it's more accessible. So I'm happy to stay on, and I will ask our other panelists to stay on for a few more minutes, and we will address questions as they come in. So thank you, but that completes our agenda for tonight. Cindy, no, I don't have an exact date, but we've been doing these in the spring, the summer, and the fall. So I would imagine sometime in June. July is always tricky with both holidays, but that's the date that I will aim for, the month range.
Yeah, and maybe Sean, I'll just add to that, if we could do it safely outside somewhere, I mean, it would be a lot I think it's, I forget whose point it was, but I do think there's a sense of community we lose when we do this via Zoom. So
yeah,
that'd be great.
Okay, Shelby, thank you for bringing this up. I did not mean to ignore this question as well. I will leave it. I feel uncomfortable sharing other people's emails. We have requested people sign up for this email list directly at their own. They're volunteering to sign up for this. I feel that I shouldn't be sharing people's private email addresses with a larger group. Anytime anybody else would ask for the same information, I would tell them no as well. But I am happy to share any information that you would like. And to your point, I think the next time we will switch this from a Zoom webinar to a Zoom meeting. We are the University of Utah, so it's always difficult to judge whether we're going to have 25 people or 500. 500 would be a bit unmanageable. So today at the max, I think we had 35 people who were able to log in. So Josh, they are going to, there have been some delays with that. Those were already supposed to be taken down. We're just waiting for the weather to cooperate, but they will be, those windows will be swapped out shortly. I would say within the next month. Judith, the windows of the Marriott Library, they had some 2020 vice presidential debate, what are called window wraps or clings. So those windows on the plaza are still red, white, and blue, and talk about the debate that happened, completed in October. So those are getting taken down. Okay, not seeing any other questions. I'm going to end the meeting for everyone. So again, thank you for joining, and have a good evening. Thank you for joining. Have a good night.